Diosis could be, first of all, the presence of naive animals, so the management of replacements in the farm, because they could be coming from a non-controlled health status, and they could be also quite susceptible to the infection. As I mentioned before, the environmental contamination is a main problem, and sometimes it becomes invisible to the farmer. So also is very important the management of abortions, so biosecurity measures that we could also cover later on, because the management of fetuses or membranes of abortion should be very, very strict, and also the vaccination gaps. So if the immunity of the flock is not consistent, then this inconsistency can cause risk of the flock to have another outbreak of chlamydiosis, because the contamination could be piling up in time, and with the replacement that are coming in, then that could be the problem.
Okay, so that is like a lot of things we should consider to control abortions, but we will talk about that later on. Our audience is very curious about something that we hear quite often on the field, and is that in flocks in which chlamydia is circulating, when one animal aborts, this animal somehow become protected or acquires certain protection that protects this animal for the rest of their life. So this animal will never abort again. This animal somehow will be like cured. And I think we are in the right place to ask you if this is actually true or not. And especially if it's actually true, how long that protection may last.
Okay, this is an important topic. It's true that an animal that will abort will develop a very strong immune response that will protect this same sheep from aborting again in subsequent lambings. However, we need to consider, and it is very important, that this protection is neither complete, neither permanent. So that means that this animal will stay infected, and it'll be causing maybe shedding of the bacteria in subsequent estrus and also in future lambings. So it's a reservoir of the disease in the flock that sometimes is overlooked by the farmer.
So we can say that animals that get infected and abort once, they are like chronically infected for the rest of their lives.
They will stay infected, exactly.
Yeah. Yeah. And the protection is not so strong, because as I can think of especially mid-sheep flocks in which animals sometimes they last in the flock for a very long time, like many years. Still, we still have some flocks in which that happens, that these animals maybe they can also abort at some point in the future. And what I find really important is what you said. They become a reservoir, so they are actually excreting bacteria and infecting other animals. So it's something to definitely keep in mind.
Yes. So controlling this shedding would be crucial to reduce the environmental contamination. Yes.
Laura, you have mentioned shedding a few times, excretion of bacteria a few times. Of course, it's because it's important, like for any other infectious disease. If we want to control the problem, if we want to control any infectious disease, we need to control the excretion of bacteria. So I think it's time to find out when this shedding or this excretion of bacteria actually happen. And also, it's a similar question, when naive animals are at higher risk of getting infected.
Mm-hmm. So animals that have not been in contact with the disease will be at high risk because they don't have any immune response to it. So they will be the most susceptible animals in the flock. And once that they have become infected and they will abort, they will be the main excretors of the bacteria, especially during lambing and abortion. So the main source of infection would be the membranes of the abortion, the fetus, the placenta. Also in the lamb fur, also could be in the coat, could be a main source of infection for other sheep. And but also in the clothing of the personnel that are managing the lambing as well. So these elementary bodies are highly resistant, and they are excreted in a very, very high number during the abortion.
Okay, so now we are going to talk about diagnosis. We are going to learn a bit how to get a conclusive diagnosis of the problem. To do that, Laura, the first question is a very simple one, but I'm sure that this could help us keep an eye on the animals and suspect something. So when should we suspect that Chlamydia abortus or any other infective pathogen may be circulating in the flock?
So, as we mentioned before, the concentration or the storm of abortions would be a key for us to suspect the disease is present. That could be very important, but also the presence of stillborn lambs could be also indicative of the presence. And if we look closely to the membranes or the placentas that are shedded during the abortion, these characteristic lesions are a little bit different from other diseases, could also be indicative of the disease. But it's very important to focus that it's always important to send samples for a specific and etiological diagnosis for the pathogen.
Okay, so clear, we should suspect that something is going on, not like natural abortion, something else is going on. When we see a lot of abortion, short period of time, also the membrane of the placenta, but this is suspicion. I mean, this is, we should suspect, but we need the confirmation. So to be 100% sure or to confirm or discard chlamydia, what would be your recommendation always?
To discard, we should always confirm in a reference laboratory, sending samples from the cotyledons that should be necrotic and some intercotyledonary membranes also. The confirmation is crucial, yes.
Okay, so always send samples to the lab. Always look for the lab confirmation.
Mm-hmm.
Great. Right. That answer actually opens the door to the next question that many of our viewers are also wondering about, and is what are the main techniques being used in these diagnostic labs?
Okay, so the gold standard of the diagnostic techniques would be the molecular identification of the pathogen by PCR or more specifically quantitative PCR to identify the DNA. But also we could use also serology, but serology should be interpreted as in a flock level to understand what the situation of the immune response of the animals are having, and with several samples. We could also use histopathology to more specifically identify the lesions in the placenta and identify the pathogen within these lesions. That's also very useful. And isolation of the pathogen in vitro in cell culture is only used if we need to identify which strain is actually having. But this is only used in certain cases in specific reference laboratories.
Okay, and of course, getting the right results starts with getting or collecting the right samples. So it's time to talk about the samples. Which samples should we collect and send to the lab?
If we can identify and visualize the abortion itself, it would be very useful to have cotyledons of the placenta with some intercotyledonary membranes. If it's from different animals, that's much better. We could also, if we cannot identify or see the placenta, the fetus samples could be also be taken and isolate the DNA there, either from the abomasal content, liver or lung, and also the tongue could be useful. If we don't find the fetus or the placenta, but we suspect that this animal has been aborted, we could take a vaginal swab and extract the DNA from, because the excretion could be active up to 24 hours. So if it's within the first day, that's also a good sample. And on top of that, we could take the blood and, as I said, take an idea of the antibody production.
Okay, so let's imagine that, and very often it happens, that the animals that are grazing, no way we can find the placenta or the fetus, or is it really difficult to do it? So the only option we have, or the best option, is to go for serology, right? So in that case, when should we blood sample the animals? When should we actually collect this blood from aborted animals?
Okay, that's an important question because the production of antibodies is not continuous. It rises right after the abortion, and it will last for a few days. After the abortion, for around 2-3 weeks, and then it will decrease rapidly. So it's very important to focus on this window of opportunity to see the seroconversion of the animals. And if we take the blood from a confirmed aborting animal, then we should take the blood within this 2-3 weeks after the delivery of the abortion. If we don't confirm that this animal have been aborted, then we need to take more samples in order to get maybe a paired sampling, so we can see the rise of the antibodies within these 2 weeks.
Okay, Laura. So we have learned a lot about how to get this conclusive diagnosis. It's a lot of information, a lot of new information for all of us. So let's try to put all together. Let's imagine that we are in a flock in which, unfortunately, we are having abortions. We don't know what is causing those abortions, but it's the ideal scenario. So we know the animals that are aborted, or we suspect which animals may have aborted. We also have the access to the placenta and the fetus, so we can collect placenta and fetus. They are in good condition as well. So anything we may need, we have it there. What must we do?
So in this perfect scenario, we should start collecting samples from, if we can identify the placentas and the fetuses of the animals that have aborted, we could have a piece of the cotyledons and the membranes and send it in a double non-leak container or in a double bag, mainly separated from different animals. If we can take several animals, we could also send samples, as I said, from the fetus. If not, we could also take the swab, the vaginal swab, always identifying the animal if it's possible. If we are taking blood from animals, then we should take from several animals and identifying these samples. And if we can take, it's important to have the history of the case. In this case, it's important to register the information from the vaccination plan that they had, any treatment that they may have received, and also identifying how many animals have aborted and how is the replacement of this flock. So any history that can give us an idea of the case, of the outbreak, that would be really useful.
Okay, so
also if we can take formalin, some samples with formalin, that we could confirm with histopathology as well.
Okay. So besides the very interesting, that part in which you mentioned the history about the farm, all the information regarding the farm, that could help to get this conclusive diagnosis that we were looking for.
In this time, it's important to remember that when we deal with an infectious abortion, always wear protective clothing and wear gloves when we are dealing with this material, because it's highly infective.
Yeah.
That's important to remember.
Yeah, also to keep that in mind. Yeah, always be careful with that. Okay, good. Laura, I think we have answered quite a lot of questions about diagnosis from our audience. We have a clear idea about what we should do. Now it's time to move to the last part, and the most important part, I would say, at least for me, and I'm sure for everybody. And is how we can actually control and prevent this problem when we know that we already have it. And to do that, I think the best way is to talk about a hypothetical case. We have an outbreak of abortions in a sheep or a goat farm. So a lot of abortions in a short period of time. As you said, very typical from chlamydia. But we still don't know what is causing those abortions. We are facing that outbreak. What would be your recommendation? What must we do there?
In any case of abortion that we can suspect that is an infectious abortion, first of all, we need to put in place biosecurity measures, because as I said, They are highly contagious, most of these diseases. So we need to make sure that we are managing the placentas and the fetuses well. So we need to remove them, ideally by incineration or deep burial. We need to disinfect the area, isolate and mark either with a spray paint or any tag the animals that have aborted and separate it from any other lambing animals. Ideally, we should manage the flock in different groups, so separating the naive animals from the animals that can be carriers of the disease. So this management is very important. And the disinfection and also sending the samples. So getting the samples ready to be sent as soon as possible to the laboratory.
As soon as possible. Huh? Yeah, okay. Clear. So that would be like a general control measure, because this can be applied for any cause of abortions. That could help. Okay. Now, let's imagine that we, of course, follow your advice. We do all that. We send samples to the lab, and the results from the lab come back positive to chlamydia abortus. So we have just confirmed that chlamydia abortus is causing all those abortions, all that outbreak of abortions. The question is obvious. What must we do now that we know the cause?
Okay, so once that we know this cause, now we know that we are dealing with a zoonotic pathogen, and we know that it's highly resistant in the environment, so we can assume that our farm is contaminated. So reinforce these biosecurity measures is crucial. And also managing naive replacement is also very useful. So we need to increase the immunity of the flock. And at this point, I think vaccination is crucial. So at least getting these animals at risk vaccinated as soon as possible. And if we can assume that is feasible, we can actually consider the whole flock to be vaccinated, to be protected. Yes.
Okay, interesting thing. You are giving a lot of importance. You said actually vaccination is crucial here. Why is it so important to control chlamydia abortus vaccination?
So, as I said, the immunity is very important to not only reduce the amount of abortions that could happen, but also to control the excretion, the secretion of the contamination with infectious organisms. So vaccine will help the flock to reduce the excretion and to reduce the symptoms of the disease.
Okay. The next topic, we receive a lot of questions from all of you about a hot topic nowadays, especially in European countries. But I'm pretty sure that really soon this will be extended to also non-European countries. And it used to be, and it is still, but it used to be a common approach to this problem, to zoonotic abortion, and is the use of antibiotics to try to control or fix this problem, try to control zoonotic abortion on farm. And our audience, of course, would like to know your opinion on that.
Yeah. So, I didn't mention antibiotic treatment before when we are confirmed diagnosis of chlamydia, but it's actually a measure that is quite common to be used because long-lasting oxytetracycline is quite effective to reduce the abortion causing of an animal. Because it will reduce the multiplication of the bacteria in the placenta. So will reduce the lesions and will help to control the outbreak in the case of an active outbreak. So it's a quite common measure that can be taken. But we need to consider the risks of and also the limitations of antibiotic treatment. Not only because the treatment will not eliminate the organism from the animal, so it will not clear the infection. It would only help reducing the multiplication of the bacteria by the time it's multiplying in the placenta. So there is only a window of activity for this antibiotic. And also this animal will remain infected for next lambing seasons. So we are only putting, as we could say, we are only putting a plaster on the problem, but we are not solving the problem. And also there is another concern of the risk of developing antibiotic resistance. That is a worldwide problem nowadays with many antibiotics. So we need to really control the use of antibiotics by veterinary advice and be very careful with this.
Okay, so unlike many people think, we are not actually, as you said, eliminating the bacteria at all. So the animals, if we only use antibiotics, the problem will continue being there year after year, year after year. So we are not actually controlling the problem, for sure we are not, and the problem will remain there, yeah?
It would help in the moment, but we would not reduce the environmental contamination for sure. So the animals will be at risk, and it doesn't clear the infection from the animal that is treated.
Okay. So it cannot be considered as a control tool that we can have. Yeah, all right. Okay, clear that. Thanks for clarifying that. Let's move back to vaccination. Our viewers, many of them, they are wondering why we are talking about vaccination. Vaccines have been in the market for a very long time. The last one was launched 6 years ago by IPRA. But before that, there were many others available in the market. So everybody had access to that tool. But despite that, chlamydia abortus nowadays is still considered the most prevalent pathogen causing abortions in small ruminants. Why is that? I mean, how can this happen? Eh? We have a vaccine specific for a pathogen, but still this pathogen is causing the most of the abortions we can find. How is that? Why do you think that this is happening?
Well, this is a common problem for many infectious diseases. So we have a lot of vaccines for many infectious diseases, and these diseases are still around, for many years. So vaccines are not 100% effective. Not any vaccine is perfect. I would say that that's the short version of the answer to your question. But also, this pathogen has the ability to resist in the environment for a long time, and this risk of contamination is one problem. But also, this disease is hidden in most of the flocks in animals that are not showing any symptoms, and these animals may not be vaccinated. So vaccination sometimes is not complete, and the protection is not the same in any animal, in all the animals, I mean. So they will develop different immune responses. So this variability would be part of the cause for this kind of not complete protection from just one measure, I would say.
So it's extremely important to make sure that we follow the protocols of vaccination. So we vaccinate, if it's needed to vaccinate the whole flock, let's vaccinate the whole flock, not leave some animals not vaccinated because things can become worse in the future. And also not rely only on vaccines. Also, well, you have mentioned a lot of things that we should be doing actually on farm. Maybe we should not only rely on vaccines, right?
That's a very, very important topic. So sometimes people would rely on one measure thinking that this is the only thing that they can be doing, and that's not actually this is actually true. So biosecurity and controlling the contamination is crucial, is very, very important. And sometimes that's overlooked also by people that are relying on a vaccine, or they think they are protecting the animals just by that. But management of replacement is crucial, and biosecurity is crucial. So both things together with the aid of the vaccine would be the best option that we have to control the disease, because it's a very tricky disease to be controlled, because it can be hidden from the animals. It doesn't show in most of them. So when it happens very, very strongly, but then there are certain years where it doesn't appear. So we can relax in that time.
Okay, I got another question for you that I'm sure that everybody would like to know the answer. And we have talked about the pathogen. We have said that it's everywhere. It's very prevalent. It's causing a lot of abortions in many small ruminant farms, sheep and goat farms. So a lot of farms are at risk. So the question is, which farms should vaccinate, or which farms would you recommend to start or at least consider vaccination against chlamydia abortus?
So, as this disease is considered to be endemic, I would say that most farms are at risk to become infected. So, depending on the management of the replacements, if we are buying the animals from an unknown health status, or we are buying animals from other farms, then we should consider to get them immunized. That's really important. Also, if we are sharing pasture with other animals, then vaccination could be implemented, would be very, very useful too. Yes.
Okay, clear with that. That was the last question we have prepared for this last part, the control and prevention. I think it's pretty clear now, but we have some good news because we still have some time. So we have received also some more specific questions from many of you that we have time to answer. So let's go for it. The first one is a question that I would love to ask you, actually, because it's very frustrating when we see this in any flock or any herd and we don't know why. And is why in farms in which chlamydia is there, we know that chlamydia is there, has caused problems in the past. Some lambings, we find a lot of abortions, so we have like a abortion storm, we have outbreaks of abortions. Next lambing, it seems like everything is much more quiet, so no abortions at all. Maybe the next one again, so everybody gets, somehow they believe that the problem is solved, and then the next lambing, again another outbreak. Why is this actually happening?
See, yeah, this is related very clearly to the special cycle that this bacteria has. As we were explaining before, animals that will abort will develop an immune response. So if we have an outbreak, there will be many animals that would develop this immune response. So the next lambing season, the immunity of the flock would be high, and most animals will not show any symptoms of infection. Because in infected animals that are not pregnant, this infection is not visible, as I said, it's hidden. So there will no abortions, but there will be animals that are infected. This small amount of animals that will abort, that may abort, and they are overlooked by the farmer, they are excreting bacteria. And also there is shedding in the estrus, or animals that are not aborting, but they are infected and they are also shedding. So the environmental contamination is building up in these years that maybe are quiet from abortions, but the contamination and the infection is increasing. These naive animals may be still coming in the flock, so there is a perfect kind of situation for these infected animals that are not showing the abortions. The next lambing season will start aborting. So in these quiet years, there are infected animals that are not showing the disease, and they will start the next. That's why it's a cycle.
So again, the problem is the same, that we do not see anything, but a lot of things are happening. Eh?
Yeah, we may not be seeing it, but the infection and the contamination is still present.
Okay. Okay, understood. Some of you are also concerned not only about animal health, also about your health, about our health, about human health. We know enzootic abortion is a zoonosis. So affects, of course, ruminants, sheep, goats, cattle, but also humans. So some of our audiences would like to know a bit more about that. Like exactly, they want to know what risk are men and women at, and also if you know any case of chlamydia abortus causing some problems in some people.
Yeah, this is an important topic. So it's a confirmed, chlamydia abortus is a confirmed zoonotic disease, and it affects very, very highly in pregnant women. So it can cause reproductive problems and quite an important disease in pregnant women. So absolutely, pregnant women should avoid any lambing with abortions dealing with these materials is highly risky for them. But also we know we have confirmed, the infection of workers that are highly exposed to these elementary bodies that are infectious. If this contamination is very high and they are highly exposed, they can develop a respiratory disease. So it can colonize the lungs and produce atypical pneumonia. So we need to consider this pathogen as zoonotic and be cautious with it, of course. Yes.
Okay, so definitely pregnant women, they should avoid being close to especially to the lambing areas, yeah?
Yeah, it's quite a risk
but everybody should be careful.
Exactly. And not only because of chlamydia, there are other infectious diseases that can be very high risk for pregnant women. So especially avoid this during pregnancy, yes.
That's another important reason to try to control this problem. Not, of course, we have to take care of the animals, but also thinking also about our workers
and veterinarians.
Veterinarians. Okay. Laura, the next question is about diagnosis, about sampling. People are interested about that. They still have some doubts to resolve. We already talked about the techniques, etc. But our audience wants to know, let's imagine that we have an outbreak, so plenty of animals aborting, unfortunately. So which animals from all those should we test, should we sample, and how many animals, or how many samples do we need to send to this diagnostic lab?
If we can identify the animals that have aborted, this would be the ideal situation. We should send samples from the placenta, the cotyledons or the membranes, of course, rightly wrapped and in a non-leak container, identified and separated from different animals. So maybe 3 to 6 animals would be good to have several of them. If we cannot retrieve the fetus or the placenta, because from the fetus we could also send samples, as I mentioned before, maybe the liver, the tongue, the lung would be also useful. But if we cannot retrieve placentas or fetuses, we can also take a swab from the vagina within the 24 hours after the abortion. That's also a good sample, and these samples can be sent as soon as possible. And if we cannot get any of these samples, or we want to complete the diagnosis, we could also send blood. If we get access to the tissue, we should consider also histopathology, because that's also a good help for the diagnosis, sending in formalin. But if we cannot get the tissues, then we can take blood from at least 10 animals. That should be, because serology should be interpreted as in a flock level, because not all the animals will produce antibodies at the same pace or in the same level. So we need to interpret these results as a flock level. So we can identify animals that have aborted, at least 10 would be good number. If we cannot identify these animals and we need to get an idea of how the flock is protected, then we should double that number and get at least 20.
Okay, clear. We have time for one more question. And it's actually a very interesting question coming from some of you. And it's about vaccination. Some people have still some doubts about the timing, the ideal timing. So the question is, imagine again that we are facing an outbreak. And we are definitely, we really want to start vaccinating as soon as possible. But when would you recommend for this farmer to start vaccinating?
So, as I mentioned, during the outbreak, the shedding will be at this peak. So there will be a lot of contamination in the environment. So we need to protect the naive animals, or the animals that are at risk, as soon as possible. So my recommendation, if we have a confirmed case of chlamydia abortus, is to start protecting the animals as soon as possible, at least the ones that are at high risk, yes.
Okay. That fits very well with some inactivated vaccines that are available in the market that, it's actually safe to be used during pregnancy as well. So this would help our farmers to actually look for this mass vaccination that you mentioned before. So that could be a good tool.
It's possible.
Definitely.
Yeah. If it's possible, yes, as soon as possible.
As soon as possible. Always act as soon as possible.
Yeah.
Okay, Laura, that answer brings us to the end of this webinar. Our goal was to understand better the chlamydia challenge and to explore how to control and prevent this common problem, this enzootic abortion. We have done that, so we can say that we have achieved our goal today. So a huge thank you, Laura, for sharing with us your expertise, for answering all our questions. I really believe that your insights today have helped us connect science with everyday farm practice. So many thanks for being with us today.
Thank you very much. It's been a real pleasure, and thanks for the invitation.
Great. And thank you all for being there, for your thoughtful questions. I really hope that you have found this webinar as valuable as I have, and especially that all we have been discussing here today is actually useful for your daily work. Before we wrap up, I would like just to highlight a few messages about what we have learned today, which is a lot. Before this webinar, we knew this problem was a challenge, was a challenging problem, difficult to control. Well, now we understand why. And also Laura has reconfirmed that we were right. It's not easy to control, but also she has sent a very optimistic message. It's difficult, but it's possible and we can control it. And now we know what we should do to control it. So there is a solution for this problem. We have learned a lot of things, but one of the things that I would say that I have learned is that we need to act quickly, even before we know what is causing those abortions. As soon as we see some abortions on farm, we need to implement these general control measures that Laura was mentioning before. That's the way to already start protecting naive animals, reducing the risk of infection of those animals. So we need to do it as soon as possible. Second step, it would be to get a conclusive diagnosis. Again, as soon as possible, we need to know what is causing all those abortions. We need to find out what is the real cause of those abortions. So always send samples to a diagnostic lab. That was another clear message from Professor Laura. And finally, when we get the results back and they are positive to chlamydia abortus, so chlamydia is causing the problem, we know it, we need to implement all these specific control measures for chlamydia, biosecurity, all that, but always we need to combine that with vaccination. If we want to control this problem, we need to vaccinate. Vaccination is not optional. Vaccination is the only way to reduce the excretion of bacteria that, as we said during this webinar, is crucial to control this problem. So combination of specific measure plus vaccination always, and this will help us control the problem. With all that in mind, I think we can close the session. Well, Laura, again, many thanks for your help.
Thank you very much.
Many thanks to all of you for being there. Have a wonderful day, and we look forward to seeing you again soon. Goodbye.